everyone, and welcome to your Breathe Respirology in Calgary. I'm Dr. Olga and practicing respirologist. I have lots of questions from my patients about use of the inhalers, so I decided to create few videos to discuss the inhalers, and this is the first one of them. There are a number of devices available for use to deliver the medications into the lungs. And generally, the medication can be presented either in liquid format or a powder formulation. Let's talk about some inhalers. This is the L-shaped device or Metadose Inhaler. It has been around for the longest time. To use it, it requires the activation, and then it generates the mist for the short second. So if it used directly to the mouth, it requires the coordination of the effort for the patient, which may be difficult or impossible for some of the patients. As such, the air chamber was developed, which needs to be attached to L-shaped device, and now when it's activated, there is no longer need to coordinate the inspiratory effort with the activation of the device. In addition, it allows for more effective delivery of the medication in this L-shaped device. So always need to be used together. The next device is a Respimat. It's a newer device, and when you activate the Respimat, it delivers the mist of the medication, which lasts for a few seconds, and that allows time for the deep inspiration for the medication to be delivered into the lungs more effectively. So it doesn't need any additional devices for use. Then there is vast variety of inhalers that has a powder formulation. It includes Ellipta and Genuar and Discus among them. All of the devices, though, depend on your effort in order to deliver the medication effectively. So for some patients who are breathless, this is a real challenge because one needs to generate enough flow to deliver the medications effectively into their lungs. In addition, some of the devices have more steps in preparation and for the device to get ready for the delivery of the medication, and some devices are a little bit more straightforward. This may be a problem for people who have arthritis in their hands or reduced vision, so some of the devices may be more difficult to use for them. Finally, the most frequent complaint that I hear from my patients who use the inhalers is the voice change. Unfortunately, that can happen with any device. In my experience, though, the powder formulation can affect voice more than the liquid formulation. In addition, if the formulation contains anti-inflammatory component, this may also affect the voice. Generally, we recommend rinsing thoroughly after using the device with the anti-inflammatory component, and that in fact reduces the effect on the voice. Finally, if you are prescribed the inhaler and it doesn't work for you or you have difficulty administering the inhaler, talk to your prescribing doctor, as by working together you can find the device that works best for you and achieves the best effect. As usual, breathe easier, live healthier, feel better.